I grew up in Johannesburg, South Africa. I actually went to medical school in Johannesburg, and when I completed medical school there and my internship, I came to the United States of America. I went to Cleveland and attended the Cleveland Clinic Foundation Hospital, where I completed a general surgery residency, followed by a plastic surgery residency, as well as a one-year hand fellowship. Well, after Cleveland, I came down to San Antonio and went into practice with two other plastic surgeons. I did a lot of hand surgery, and then I started to do more and more cosmetic surgery. I eventually stopped doing hand surgery to move more into the cosmetic field, and was doing what we call extended or circumferential tummy tucks, which is going around the back. A bariatric general surgeon friend of mine then referred me a patient who he had done bariatric surgery on and had lost a considerable amount of weight. This patient was not happy with the way she looked after this, with a lot of excess skin. And I went ahead and did my circumferential abdominoplasty. Especially here in San Antonio, I believe I'm probably the only surgeon who does multiple procedures in one operative setting. With the help of dedicated assistant plastic surgeons, I'm able to, usually within 2 operative settings, 3 months apart, get these patients back to a normal lifestyle, which is what they've wanted since the beginning of their journey, which started with their initial bariatric procedure. When I'm doing a body lift, fairly routinely I'll do an auto augmentation of the buttocks. That's using the patient's own tissue to augment, make larger their buttocks. Typically, unfortunately, when patients have bariatric surgery and lose a lot of weight, especially when it's rapid weight loss, they lose their buttocks, their hiney, and they want something done about that. Rather than putting in a foreign body such as a silicone implant, I use their own tissue to augment it. It helps with the general body contour, not just the buttocks themselves. I've also come up with a procedure myself that might be done by other people, but I'm not sure of, that augments the patient's hips. I believe a lot of body lifts, unfortunately, flatten the hip line and give more of a boxy look to the patients. I was getting these results myself and came up with this procedure myself, which I believe considerably improves the appearance of the patient afterwards, giving them much more of a curvy look. I try to give a flatter scar across the lower abdomen when I'm doing a body lift in a male, whereas I try to give more of a what we call a W-shaped scar in a woman. This is because I want more thigh to show if they want to wear a French cut bathing suit. I do all of these procedures in a hospital. I believe it is much safer to do it in the hospital. Most of the patients, especially if it's doing anything with the tummy, will stay in at least overnight. If I'm doing just the breasts and the arms and sometimes even the legs, they'll go home the same day. The hospital is a better setting because there are potential serious consequences to these operations, which can be immediate, such as pulmonary embolus, heart problems. And in the hospital, I have internists who can help me take care of these patients if such an unfortunate consequence arises. They very rarely occur, by the way. There are unfortunately frequent, small delayed complications with this kind of surgery. We're making large, long, big cuts, and because of that, there's probably a higher rate of smaller complications occurring. And the most common is that of stitches spitting out. By the way, I put in all dissolvable sutures. There are no sutures to come out. I don't use staples. And that way I believe we get the best scars, and I don't have to worry the patient about getting stitches out, which sometimes hurt, leave unsightly scars, and so forth. Many patients want their thigh lifts. In fact, sometimes they come in just wanting a thigh lift. It's more the rarity just wanting the thigh lift by itself, but many do want the thigh lift. Because the body lift in of itself gives a lateral thigh lift, I infrequently do the two together. I like to see what the result gives from the body lift, and then we go ahead and do a thigh lift, which is typically cutting the skin out from the inside of the thigh. The other procedure, of course, is facelifts. People, unfortunately, look very gaunt. They've lost weight around through their body, but they also lose weight in the face. So their face tends to sag, including the neck, and we do facelifts for this. Often needing to augment the face by putting in either fat or alloplastic materials. The recovery time is very dependent on what kind of procedure I've done. Whenever I operate on the abdomen, doing a regular abdominoplasty, or if we're landing up doing a body lift, most of these patients will need at least 2 weeks off of work. If they've got a sedentary position, they might be able to go back at 2 weeks. If they have more of an active position, then it might take a little longer, 2 to 4 weeks, and even up to 6 weeks. Most of these patients I will not let exercise for 6 weeks. They are to take it fairly easy for 6 weeks. They can usually drive at 2 weeks. If I'm not doing the body lift and I'm just doing, let's say, the arms or breasts, then a lot of these patients can go back to work within a week. It's very dependent, of course, on the patient and the extent of the procedure that I'm doing. But very often they can go back fairly early in their recovery. I believe I have the experience and the results equal or better than some of the most distinguished post-bariatric plastic surgeons in this country. I've made post-bariatric body contouring my #1 procedure. I'm extremely passionate about it. I don't want to do much more than that. So all of my time is spent thinking, working on new procedures, better ways to give patients better results. So essentially, my focus is completely on this kind of surgery.